All right, guys, I am back. And I'm back because somebody shared a Reddit post from the r/psychiatry subreddit, and I just sifted through this and I just had to make a video on it. This is a good one. So you can find the post linked in the description box, and I'm just going to read the OP for you, and I will restrain myself from interjecting, and I'm just going to read it. This is a good one. This is really good. We're going to have some fun with this. All right, the OP writes, I recently learned about the PSSD subreddit through a patient of a colleague. For context, this patient clearly met all the diagnostic criteria for narcissistic personality disorder, NPD. My colleague, after conducting a comprehensive personality disorder assessment, confirmed this diagnosis. However, the patient insisted that his sexual and interpersonal difficulties were entirely due to a past failed trial of just 5 milligrams of escitalopram. To complicate things, a neurologist had told him that post-SSRI sexual dysfunction, PSSD, was likely the cause. When my colleague explained that the symptoms could be better explained by underlying affective and personality pathology, the patient was furious. He claimed that psychiatrists always invalidate the experiences of individuals with PSSD, something he had read about frequently on the PSSD subreddit. After reading a number of posts on that subreddit, I find myself considering two possibilities, or perhaps a blend of both. One, we might be overlooking a group of patients who feel invalidated by the way we assess their symptoms, and research in this area is lacking. Two, PSSD may not be a fully established nosological entity, but rather something being amplified by individuals with personality pathology who use limited scientific evidence to explain their frustration with their sexual and interpersonal lives. I'm genuinely curious to hear your thoughts. Have you encountered patients presenting with PSSD even after low doses of SSRIs, long after treatment cessation? Is there more we should be considering in our assessments? Now, also important is one of the first follow-up comments on this thread. And keep in mind, these are all professionals. You have to be a verified professional, like a psychiatrist, in order to post on here. So this is also important, and I'm going to restrain myself and just read this comment, because this is also important, okay? This person writes, there are a few different concepts that need to be combined to understand what is occurring with PSSD. 1. Not all patients are the same. This is crucial. You can't boil the phenomenon entirely down to a side effect or entirely to a personality component, as every patient/provider will have a different experience, and how much personality is contributing to a side effects will vary greatly from patient to patient. You can't make a blanket statement such as XYZ is caused solely by XYZ personality factor. 2. SSRIs can cause nearly any side effect and seemingly opposite side effects. It's a drug that affects neurochemistry. Some patients get sedated, some get wired, some go manic. Each individual has widely different effects from it. That said, we know that sexual dysfunction is an incredibly common side effect of acute use of antidepressants. 3. A huge component of sexual dysfunction is psychological. Not entirely, not always, but a huge component is psychological for most. 4. A strongly held belief can create a feedback loop that worsens sexual dysfunction. Any belief can be held to explain sexual dysfunction. I can't get an erection unless XYZ. This can be a belief that holds some truth, but is an overgeneralization. Imagine this. You have a breakup, and you don't get hard on your next sexual encounter. What's internalized? Do you chalk it up to nothing? Great, you'll probably get hard next time. Or do you internalize, quote, I'll never get an erection if I'm not with XYZ, end quote. This will create a damaging feedback loop. 5. there is some comfort in believing your sexual problems are not your fault. For some people, external blame of sexual problems preserves the ego. 6. Some providers are invalidating. There will be providers who quickly invalidate a patient's experience or push a belief such as, quote, PSSD is made up, end quote. And 7. And some patients will seek out being invalidated. Seems counterintuitive, but there will be patients who will cause invalidation through projective identification. A patient who gets comfort in a false belief won't be open to hearing alternative causes of their dysfunction. This can make a provider feel ineffective and frustrated. And then he or she goes on to say, where you personally stand on how much an SSRI can biologically cause a prolonged sexual dysfunction will be entirely individual. There is little data to guide us on this. From my clinical experiences and interpretation of the data, it seems like a proportion of patients are likely experiencing sexual dysfunction as a result of an aberrant, strongly held belief that developed from the SSRI. In parentheses, they write, I can't get hard, and it's the medication entirely, which creates a feedback loop to make the belief true. Said another way, it's very possible exposure to the drug physiologically caused a sexual dysfunction, which created a psychological belief, which continues the sexual dysfunction even on cessation of the drug. This would mean that a successful treatment would consist of the patient trusting the provider, which requires the patient feeling validated by an empathic provider, and then clearing the psychological dysfunction. It wouldn't be incorrect to say the drug caused the prolonged sexual dysfunction, and it also wouldn't be incorrect to say that it's not the drug exposure that is perpetuating the prolonged sexual dysfunction. While this seems to be saying the same thing, it's not. And this has 147 upvotes at the time I'm reading this. Anyway. Alright, so there is a lot to come back on here, but there's one main takeaway from this, and I'm going to keep this short and sweet, is the hypocrisy of focusing on mind over matter, like placebo effect, nocebo effect, memories, thought loops, all these things, like this guy was calling them negative feedback loops. Okay, the hypocrisy of only considering all of that stuff after somebody's been harmed by medication, and the hypocrisy of espousing that. I mean, the mind is really powerful. It can do crazy things. I mean, it could give you severe sexual dysfunction. It can cause all these things. The hypocrisy of claiming to be aware of that and then accusing people of that being their problem. The hypocrisy of your frontline treatment as a professional being medication. So you're saying that you believe the mind is so powerful that it could create genital numbness, it could create severe erectile dysfunction, it could create complete vaginal dryness and clitoral numbness, it could create severe premature ejaculation, rapid detumescence, orgasm dysfunction, pins and needles sensations throughout your body. It can cause all of that. But somebody's going to come in to see them for basic depression and anxiety, girlfriend, boyfriend broke up with them and they're really depressed. They're going to come in to see a professional for that. And their first frontline treatment is medication. You've got a brain imbalance, we've got to correct it, you're probably never going to get past it, it's a brain chemical problem, so you've got to get on medication. And then you're just going to have to use medication to manage it. It's not going to fix it. You've got to stay on it probably for life to manage it. So the hypocrisy of that being the frontline treatment, and then if something goes wrong with the medication and they're having an adverse reaction to it, now we're going to say, okay, it's placebo, nocebo, mind over matter, thought loops, or what do they call it? Negative feedback loops. I call them internal representations. I came from NLP. So when I was working with people and working on myself, that's the background I was coming from. Which, by the way, for EMDR, I did not do EMDR, but I did a similar methodology. And Francine Shapiro, who founded EMDR, worked for Richard Bandler, who was the grandfather of NLP. Never credited him, never credited NLP. My theory is that because it had such a bad reputation with psychology, she kind of wanted to insulate. Maybe she wanted EMDR to be successful, and she knew that it might not be taken seriously if she mentioned the ties to NLP and Richard Bandler and all that. But anyway, all that aside, That's important to mention, by the way, because if professionals had the ability, like I learned, and I'm not saying I'm like perfect at this, but I did have a lot of success with people and with myself, but how to address memories and belief systems. So if somebody is stuck in a negative feedback loop, it's like being able to go into their mind, helping them to go into their mind and look at what's going on, help them get into their subconscious, start bringing up these belief systems and negative feedback loops, exposing the roots of them, and then pulling the roots out one at a time. And then all of a sudden, when you pull those roots out, i.e. the negative emotions that are supporting these feedback loops that are unconscious, then the whole house of cards falls apart, right? The whole problem can even disappear. I remember one lady I was working with was having a severe migraine headache, gone. Like we're doing a eutaptics session. 10 minutes, I remember this back in 2014, and it disappeared. Now, again, we could get on that topic, right? Because a migraine headache going away, that seems pretty extreme. People say that's not possible. And then you're going to have the people like, see, you did it yourself. Like you're doing this tapping, and then through the power of thought alone, her severe migraine headache just disappeared. I'll never forget that, by the way. Her eyes popped open, and she just looked at me, and she goes, it's gone. How the fuck did you do that? That's exactly what she said. I'll never forget it. Anyway, but here's the thing. You ever notice how, so when you go in to get treated, it's all about brain chemical imbalance and you need to be on medication. So if they really do believe that the mind is that powerful and can create all of these negative symptoms, why would their frontline treatment not be working with the mind to see if that can fix everything first? Forget the medication. You come in and you're depressed or you're anxious or you have this other things. Okay, oh, well, good thing we understand the structure of the mind and how problems work, how belief systems work, how negative feedback loops work. Good thing we know how to go in there and guide you through your subconscious, go into your memories, traumatic experiences, anything that is supporting this negative feedback loop, and pull all the roots out. Good thing we know how to do that, so even after a 1-hour therapy session, you can walk out of here feeling much better and thinking about something that was bothering you that day and it doesn't bother you anymore. Good thing we know how to do that, right? I'm being facetious here because they don't know how to do that. And I'm not saying this to claim superiority. I think this stuff is actually fairly easy to learn, and I wish professionals could learn it. Like, I came from the school of, Robert Smith's eutaptics, which is what he's calling it now, and it's very similar to EMDR, but it's basically the point I'm making is like, it's not like I'm not saying this to be superior, like, oh, well, I have this secret knowledge that they don't. It's like, no, I think it's common knowledge. And I think it should be standard practice to try alternative therapies first, and they have to be effective to know, you know what I mean? You have to know what you're doing to really see, like, is this actually going to help someone? And then consider medication afterwards. Or at the very least, give people informed consent and be like, look, we have a lot of evidence piling up that, like, these medications can cause permanent side effects. So whatever problems you're dealing with now, here are some, like, case reports. Here are some stories from people that have dealt with, permanent sexual dysfunction. You should read through this stuff and see what other people have dealt with. Like, we're not saying it's going to happen to you, but it could. So we want you to understand that if you take this medication, this is a risk. Make people aware of that, and then they can decide for themselves. It's like, are my problems bad enough that I would be willing to roll the dice on potentially developing problems like this? Like, my depression or my anxiety or this other stuff is so bad that I don't care if I got anhedonia. I don't care if I had permanent sexual dysfunction. I don't care. Just saying, so anyway. Yeah, and so just the hypocrisy of you're going to espouse the power of the mind and negative feedback loops and, again, memories and internal belief systems and all this stuff after somebody's harmed. Now we're gonna say that that's the root cause. But when someone comes in to see you for depression or anxiety, like run-of-the-mill depression or anxiety, it's not even on the table as an option. Oh, we're not going to look at how your mind is working or your belief systems. Like, isn't that funny? So, and I did want to make a point too. We have to level the playing field. If we're going to lob these things at patients, we have to flip it back to the professional. So here, there is some comfort in believing your sexual problems are not your fault. Yes, okay. Would you not also say there is some comfort as a professional in believing that it's not your fault when patients under your care are harmed by something you did? Is there not comfort in believing that that's not your fault? Could that not reasonably lead to somebody wanting to deny to protect their ego? Like they mentioned here, projective identification, a strongly held belief can create a feedback loop that worsens sexual dysfunction. Is a strongly held belief such as like, I'm treating my patients in the best possible way, I'm doing everything right, I'm making a difference in the world, I'm really helping people, is that not a strongly held belief? Okay, and it's like, is that not going to be challenged and create some cognitive dissonance and discomfort if it's like, oh crap, I have someone that I, prescribed this thing to and now they're having a lot of issues. Could there not be cognitive dissonance on the professional's part that could encourage them unconsciously to just dismiss it? It's like it's too uncomfortable. It's like, no, because think of what a professional would have to lose. They might have to reevaluate their entire career. If we're going to look at the potential, like this whole thing with PSSD is starting to blow up more and more, and if it comes to light that it is real, which I know it is, but, when more evidence comes out, there's going to have to be a massive restructuring, and I think a lot of professionals are going to have to go through a lot of cognitive dissonance. Like they could choose to just not care at all and ignore it completely and not have any cognitive dissonance and basically continue harming people and just not caring about it and then blaming them. But, all this stuff about patients, it's like, oh, well, sexual dysfunction, it's much easier if you blame someone else rather than take accountability. It's like, have you looked in the mirror? Have you looked in the mirror? And I understand, okay, in my own field where I have screwed things up and I've had people pissed off at me and it felt horrible. So I can only imagine, like, something much more serious than things I did, which is like screwing up on like mechanical objects, like let's say you were like repairing an engine and you effed something up and now you can't fix it. It's like, yeah, that's not good. But, how much worse would it feel if it's a human being's life and you just really screwed something up, like their sexual function is just destroyed? That could cause a lot of cognitive dissonance. Could feel pretty bad. So that's why I encourage, this is my approach. I think, again, if patients and professionals, if we're going to have any understanding, as a patient, like I've been, you have to, like I can be snarky in my videos. I have a little bit of an attitude, okay? Like, I'll joke around. You got to have a little humor. But face-to-face, like with a professional, it's like I do think it would be wise for patients to be very careful about how they're talking and to be mindful that a professional is going to have a massive amount of barriers to protect their own ego. If you start getting mad, you start lobbing insults, it doesn't matter if what you're saying is true, it's not going to get through. It's like, do you want to be right or do you want to be effective? So that's the thing to consider. So I think that's really important to consider. Anyway, that's my take. I guess as the years have gone by, maybe because my hormonal profile sucks so much, they're just like, testosterone's totally depleted. But I've calmed down a lot, in more recent times, and it's like I am much more about, I think the best way to go about this stuff is peacefully spreading awareness. It's like if you're logical and respectful, don't start shit with people, and I'm talking about patients like me. It's like, I understand. It's infuriating. I was even encouraged within myself, to make this video, because I got super triggered by reading this. But now, it's like I've calmed down a little bit, and it's like, okay. Dude, I'm coming up, I'm over 6 years now for a sexual dysfunction. I have not been able to have sex, like physically capable of having sex for over 6 years now. And, satisfaction from orgasms. It's like the last great orgasm I had, like truly great one, like over 6 years ago. So, I've had the severe premature ejaculation. Now I've got ED. I have rapid detumescence, which means like my erection is losing all of its strength before I'm even done ejaculating. that sucks. It sucks. It's not as bad as retrograde ejaculation, which I had for months after taking prednisone. Thank God that went away. But, like, you know, man, I've been through a lot of shit in my life. I really have. I've had people do all kinds of horrible shit to me. I've suffered a lot. A lot. I've suffered a lot in my life. Like many people have, you know? But I put a premium on being civil with people, and then it's also like, me getting mad and yelling at someone, it's like if they're not receptive, it's like that's only going to make it even worse. So it's like if somebody truly is like a total sociopath, or like have no empathy, or a psychopath or whatever, if they have no empathy and they don't care, it's like just fuck it. You're better off just letting it go anyway and not letting it take space up in your head. So I think the best way to reach people is peaceful discussion. And, I mean, it is funny because, yes, I can get a little snarky in my videos. I hope anybody watching this can forgive me for that. I mean, you might understand why I'd want to be a little snarky, especially in a video I'm making where I'm just talking to a camera. I'm not talking to another person right now, so if I was face to face with someone else, I'm not snarky. I don't get, I don't get snippy with people. I don't yell, when I'm talking about this stuff. So anyway, I could go on, but I did want to point out, I thought it was interesting, this kind of hypocrisy, with, okay, we're going to look at the mind and the power of belief and these feedback loops and all this stuff and memories and internal representations and all the power of the mind and mind over matter. Like, why are you waiting until after people are damaged? And then it's, oh, man, and you don't want to deal with it, so you just offload it onto them, and it's like, well, they're just making it up. They're probably narcissistic personality disorder, and it's like, why wait until then and just not have this as the frontline treatment? Have a mind-based, right? Memory, belief systems, the structure of beliefs, right? Feedback loops, positive and negative. It's like understanding how they work, how to tear them down, how to rebuild them. It's like it's like a, Jenga tower sometimes. It's like you hit on a major trauma that was very highly emotionally charged. You pull out that, one Jenga block and the whole thing falls down. That can happen. And it would be a real tragedy, if somebody like that could be helped by a methodology like that, and instead they get on a medication that ends up giving them permanent sexual dysfunction or worse. So anyway, I'm trying to see both sides, like I can understand for professionals. It's like they have a lot of stress to deal with. I get it. And I think it's just going to create more of a rift when people forget, even if you don't like people, even if people do horrible things, we are all human beings. And that might be the hardest thing, for PSSD patients to do, is to, like, I was pissed off. When initially when I made this video, I was really heated, and I'm like, I'm going to rip into these people. I'm really mad reading this. And I'm kind of coming back more to my senses now. I'm like, you know what? I can point out hypocrisy. I'd be a little snarky to be cute, to be funny, make it somewhat entertaining to watch. But, like, my real core beliefs, it's like everybody is a human being. All right? Even the bad people. So even people we don't like. People we want to yell at and swear at and, get really angry at and whatever. It's like, but it's never going to lead to anything good. It's never going to happen, so. And it's not like a moralistic thing, like, oh, you're taking the high road. It's like, if you really look at it logically, again, speaking of psychology, it's like you're going to be much more effective if you are respectful of people and you're really attentive to their emotions, kind of attuning to them, again, even as a patient talking to a professional. I think, anyway, I could go on and on about that. I'm getting kind of tired, so I'm going to have to cut the video. I'd say I still have a fawning response, and I know a couple other people I've gotten close to. It's one person in particular in the PSSD community, and I'm not super active there anymore. But I made a couple, like one particularly very close friend. But other close friends too. And, one of those friends had issues with fawning like I do, where, like, they could be super mad, but then they're in a situation with an authority figure, like a medical whoever, and they're just shut down and not say anything. I think the last time I talked to them, though, they did say they actually yelled at one of them. Like, they got really mad about something, and they let them know. So, in a sense, good for them. standing up for themselves. Some of us have a very difficult time. I think that's how a lot of people can end up on medication too, even if they don't want to take it. Again, frontline treatment being psychological, and then looking at the structure of problems, the structure of belief systems. I think that's going to be the main way to address things in a healthy future for humanity. And again, if a therapist could tune in and notice, hey, this person seems anxious around me. I just suggested medication and they kind of clammed up and broke eye contact and they're rocking back and forth a little bit. They're looking a little anxious. It's like, hey, what's up? Like, did something I say about medication, did it bother you? And, oh, no, I'm fine. And I'm like, well, you don't seem fine. Like, I mean, it's okay. Like, you want to tell me, like, do you not want to take medication, or did you want to ask about, like, we have genetic testing we can do for this, or like, would you have thought, you know what I mean? Just treat people like a person. Like, because I will say, I have known many people that got on SSRIs and it, like, fixed their problems. Now, there is evidence of the placebo effect. There is. Like, they had there was one study, and this lady it was literally, and she was getting negative side effects that she thought she was going to have from the medication, and she was just given a sugar pill. I understand all this stuff, okay? Like, I'm familiar with it. But I'm just pointing out the hypocrisy of, like, okay, we're going to, it's like rules for thee and not for me. It's like, we're only going to apply the power of belief and all this stuff to the adverse effects of the medication. But as far as somebody being able to produce positive effects that a medication could produce, them doing it on their own, oh, no, we can't. No, you can't do that. You need the medication. But then you get an adverse reaction. Oh, no. That's the power of belief. You're doing it to yourself. So you see what I mean? It's like, if you really believed in it, wouldn't you be telling people, hey, you don't need these drugs. You can just use the power of your mind to overcome your depression and anxiety. I actually do think that is possible. And the irony, and I've had this conversation with many people in the community, is because I used to do this work with other people and on myself all the time. Like, all this stuff with, like, memory and emotions and belief systems. And I think it has a much more difficult time working when you're dealing with people that can no longer feel anything. They can no longer imagine anything. They can't feel a personal connection to any of their memories or anything they're currently experiencing, because the circuitry in their brain has just been altered in ways that we do not understand. And because we don't understand it, we're just going to say, well, but you have no proof. You have no proof that you were damaged by this, so we're just going to chalk it up to, like, whatever disorder you had, Which, again, I've known people that were on medication for years and years and years and years and had no problems at all, and then got off of it, and then all hell broke loose. Anhedonia, akathisia, dysautonomia, all these different problems. SSRI for years, totally fine. Stopped taking it, totally screwed. So, and then I've known other people, it was one pill. They took one pill, screwed. And we don't know why. We don't know why. So, anyway, again, regardless of where you fall on this issue, like whether you even believe PSSD is real or not, I hope you can realize the hypocrisy of espousing the power of belief and the power of mind over matter only in a negative situation. It's kind of like, it's like saying you only believe in the nocebo effect, but you don't believe in the placebo effect. It's like, yeah, nocebo is really convincing, 100% on board with that, absolutely. But placebo effect, nah, there's no evidence for that. There's no evidence of placebo. Nocebo, yes. Placebo, no. It only works one way. Like, the power of the mind only applies to negative things, period. I mean, yeah, you can think yourself into being sick, but thinking yourself into being healthier, you can't do that. You need the medications for that, because it's a brain chemistry problem. Are you following me? Like, if you want to feel good, you need a pill. But if you want to feel bad, or you are feeling bad, then it's your fault, because your mind is just creating this stuff out of nothing, and you're making yourself feel bad. But if you want to feel good, you need a pill. Because it's not actually yourself making yourself feel bad, it's a brain chemical imbalance, right? So then you need a pill to correct the imbalance. But then if you feel bad from the pill, it's your mind creating it. But it's not actually your mind creating it, because the original problem is a chemical imbalance. So you see, like, the contradictions here? You start parsing through this stuff, and the whole house of cards just falls apart. I mean, you apply any degree of logical critique of this, like logical fallacies and stuff, it's like it just falls apart. So there's just non sequiturs and double standards everywhere, like over that whole post. So anyway, and again, I'm saying that is true regardless of whatever. You could believe that PSSD does not exist, and that would still be true, that all of this stuff they're saying is extremely hypocritical. So anyway, just pointing that out, I felt like I had to comment on this. Yeah, I could keep talking about it, but now it's getting a bit later. I'm going to start winding down. But hopefully that can bring some clarity to all this stuff. I mean, I'm trying to be as chill as I can, man. You know, like, I hope I can use the power of my mind to get my sexual function back. I would love to have that back. That would be wonderful. You know, and even non-PSSD stuff. Like for me, it's like I had COVID twice and I got Lyme disease. I had a really, really, really bad flu after those, you know, and I think it's like all this stuff culminated to where I'm having all kinds of issues now, you know, so I don't blame everything in my life on PSSD, not at all, you know, certainly a lot of it for the sexual dysfunction specifically, but I got further sexual problems after COVID and Lyme disease. So it's like there were some original things that were like, yes, this was, to me, this was very obviously caused by the medication, but then additional, COVID, Lyme disease, and then a couple other things, like I was on prednisone for a back injury and got retrograde ejaculation from that for a few months. That cleared up, so that's good, you know, but anyway, you know, just trying to bring some reason and clarity here, you know, because I think, you know, the PSSD community has a very bad reputation for being a bunch of, like, raving lunatics that are like militantly anti-psychiatry, and I just want to be a voice of reason here to be like, can we all just like chill out? We are all human beings. I understand, like, look, my life was largely destroyed by that medication. Very much so. I had totally altered the trajectory of my life, and it's like, yes, not being able to have sex due to severe sexual dysfunction, which I never had before, and it started within a week of taking it, and now it's 6 years later and nothing has improved. Yeah, it's safe to say that's caused by the medication, but like, you know, I can call people out on stuff. I can call them out for being hypocrites, but it's like, I don't hate them. I don't wish harm on them. And I don't think getting angry is going to do anything, you know, to help anybody. So that's my take. You know, like, this is a war that is going to have to be fought very intelligently, and you know, I think the PSSD community as a whole needs to really make an effort. I know it's difficult, you know, but like to present themselves in the most rational, logical way possible. I mean, really, you think about it, it's like dealing with a narcissist, or like narcissistic abuse, where it's like everything you say is going to be spun against you. So it's like you have to be aware that that's going to happen. And just take it on the nose. It's like, it sucks, but you got to suck it up. I mean, that's what I've had to do. I mean, that's why I think it's good for your self-esteem too. Again, if you are a patient that is dealing with PSSD, you got to build yourself up. You know, you're a warrior, or a warrior-ess. Warrior-ess. Is there a word for that? Female warrior? Like, but anyway, you know, I mean, you really got to build yourself up. You know, I know a lot of people just beat the crap out of themselves. You feel bad enough from all the damage. So, you know, over the past period of time, I've been building myself up every day. It's like I start feeling like shit. I'm like, I'm a fucking warrior, man. I have endured fucking hell. I have been to hell and back, and I'm continuing to deal with shit that nobody understands, nobody gives a shit about. And then, you know, on top of that, it's on me to basically be the adult in this situation and shoulder this burden alone. It's like tough shit. You know, I got to deal with it. And it's like I actually do have some pride in that. It's like, yes, it is tough shit. Yeah, suck it up. But, you know, you start living like that, and you can start respecting yourself. Like, man, I mean, I'm pretty fucking tough. Way thicker skin than anybody else I've known. You know what I mean? You start talking to yourself like that, building yourself up. You know, it can go a really long way. And, you know, of course, I'm making an exception here for like the super severe people. I have a lot of empathy for that. And it was, like I've talked about in other videos, right? There's many people that delete themselves because they can't cope with this stuff anymore. And I think it is important, you know, to respect that, you know, to respect that not everybody can cope with things in the same way. That's why I'm making a video. It's like, people don't agree with it. You don't have to agree with it, but I'm not sending it as a message to someone. That's why I love YouTube. I love public platforms for sharing things, because it's like, hey, if you don't like me, don't watch it. Versus like if you're directly messaging someone, they might take it the wrong way. They might not want to hear it. And it's like, it can be imposing on someone. So I've pulled away, more from messaging people directly. And I'm like, I'd rather just share my thoughts here. So anyway, another unedited video. I don't have the ability cognitively to edit this down, so I'm just going to publish this as is with these very minor cuts. And anyway, until I feel the urge to speak about something again, who knows when that'll be. But I hope this helps someone out there, help get you thinking, a little more logically, rationally, and remember to build yourself up. If you're dealing with this stuff, I will say, like, again, particularly my experience being a man and having sexual dysfunction is very emasculating. It can be very rough, being totally alone on a like sexual and emotional, intimate level, and you can't perform, and you can't perform. It could be a pretty big blow to the ego. So my strategy for dealing with that is like, fuck it, man. I'm a fucking warrior. That's how I think of myself. It's like I'm enduring this shit that like other people would have just fucking self-deleted years ago. They couldn't handle what I've had to live with. And that's not a dig on other people. You have to understand this is to build you up. Again, coming back to feedback loops, internal belief systems, internal representations, the movies you're playing in your mind. That's what it all comes back to. And again, if we lived in a world where people were aware of that, you could have people coming in with depression, anxiety, all these kinds of personality disorders, and they could be addressing all that stuff without medication. And then it's like, if they really needed it, genetic testing, I will say there are people that get help by medication. So it's like, if genetic testing could help, where you get a thing, oh crap, like we've found a link now, people with PSSD have these genetic variations, and it's like, oh my gosh, that's why this happened to them. Like this medication did this because of that gene and that. Maybe we'll figure something out in the future. Like, I'm not knocking medication as a just across the board, it's totally evil. Like, I've known people personally that their lives were completely turned around for the better by various psychiatric medications, so I can understand how difficult it could be as a practitioner, where it's like you got like a 95% success rate, you feel really good about yourself and your job, you're helping people, then you get one patient and it's like, man, I took this pill and now my dick doesn't work anymore. And they're really upset, and then they're suicidal over it. It could be very difficult when you have like one outlier in your practice, So I know it sounds insane. I know it sounds totally insane to like, be trying to empathize with a mental health professional, somebody that I believe I was permanently damaged by one. And actually many of them, I think a lot of the issues I had actually came from being on an SSRI at a very young age, like 13, 14. That's when I started cutting myself. That's when I started having all this suicidal and other thoughts, just really not good stuff. And, then I was put on, an antipsychotic. And when I got off of those things, the self-mutilation habit persisted, but the other stuff started to dissipate, like the super crazy thoughts started to just dissipate. And it's like, yeah, I think it could have been caused by the medications, particularly given at a very young age. But anyway, this is also why I can't edit, I could keep talking and keep talking. So hopefully somebody enjoys listening to this and got something out of it. Yeah, I've said enough for this video, so until the next one, thanks for watching, thanks for listening, and again, if I'm moved to talk about something again in the future, I'll make another video. So until then, I will catch you in the next one. Or I guess I'm not going to catch you in the next one, because I wouldn't be until the next video that I'd catch you in it. So I guess that means I'm just going to cut the video here. All right.